Hi everyone. Hi, we're finally live. Thank you for a long wait and thank you for staying until 8:15 for our live session today. For those who came, thank you so much. Hope you have a wonderful day. And today let's get something, keep the day going. Well, the day is not end yet. Let's keep the day going to learn more about mental health. And I'm Jefferson. I'm the clinical psychologist in NCSM KL. Right, so you might be wondering why Kah Yee isn't here today, right? So supposedly from the poster you guys have seen Kah Yee's, supposed to be a speaker, right? So we unfortunately Kah Yee is not feeling well today, so she will not be joining us today. So for those who are fans of Kah Yee's, so sorry that you have to, be disappointed today. You're only with me here today, but she'll be back tomorrow. And Kah Yee, if you're listening, hope you get well soon, and we would like you to be back tomorrow, right? So again, I'm Jefferson. So let's get on to our webinar today. So the webinar today will be with the title of "Get a Gateway to a Better Mental Health." Right. So what we're gonna talk about today can be quite something that you may heard before or something can be new to you. Right. So let's go into it. Right. So hope you guys are ready. Right. So for today, we'll be covering an introduction to your mental health. We'll talk about what mental health is, the true definition of mental health, what does it composed of, and what are elements in mental health. And then will continue to understand what is stress, anxiety, and depression. These three terms are the terms that we normally hear nowadays, right? So make use of today's opportunity to understand better what are they. Next, we're going into discussion of what is a mental health screening. So again, you may have heard of this term once in a while nowadays. So again, we'll talk about it in detail later. Lah. And lastly, we'll be debunking some myths around mental health screening, right? So no worries, it can be seem like quite a lot of topics to get into, but no worries, we'll make it as enjoyable as possible, right? So firstly, understanding your mental health. So what is a mental health actually? So our mental health can be placed on a continuum. So a continuum is like a scale where you can slide from one end to the other end. So from this end is the healthy point, and the other end is the disorder point. So in between there's the problem point. So what are these differences? So the healthy point is the point where a person is healthy, being healthy, well the name is suggested being healthy, and disorder point is when it goes to the point that it's difficult to control, right? Oh, we have some pointers here. Okay, so for the healthy points is that when a person is emotionally stable. So let's say this person is happy, is the mood states are stable, it's not going up and down, it's not fluctuating, then it's a healthy point. So the person has good cognitive functioning, whereby the person can pay attention, have good thinking skills, and able to have positive interactions with one another, and also able to perform well at different areas of life. So if you're having these few traits, then you are probably at the healthy point. And let's go to a disorder point first. Yeah. So disorder point is where there's a specific diagnosable illnesses. So let's say a person with ADHD, a person with autism, a person with major depressive disorder. So these are the disorder point because they exhibit significant changes in their thoughts, their behaviors, and actions, and have actually affected their daily life or other important areas of functioning. So when these problems or issues have reached these certain stages, then it is a disorder point. However, as you can look through the scale here, right, there's a problem point where it can slide between healthy and disorder point. So a person having a problem point is maybe having certain symptoms of mental illness. So let's say a person have symptoms of depression or symptoms of anxiety. So these symptoms are not severe enough to warrant the diagnosis of a mental illness. And this at the same time, this person is able to perform daily life functions. So let's say, giving an example, that person who has depressive symptoms. So once in a while, he or she may be sad, but he or she is still able to perform daily life functioning. He's still able to go to work, able to um, per, able to take care of himself, able to go for grocery shopping. So although he has these symptoms, but he or she is still able to perform, and this is at the problem point. right? So understand that one person, although he or she can be healthy at one point, he or she can slide along the whole scale to reach a problem point or eventually reach a disorder point, right? So it doesn't mean that if you're healthy, you can be healthy forever, or if you are having a disorder, meaning that it doesn't mean that you have to live with the disorder for the rest of your life. You can scale in between that continuum, and that's the beauty part of psychology, of mental health. It can slide from one another depending on what are the stresses that a person is facing during that time. Right? So what are the common mental health issues that we can talk about, right? So first is stress and anxiety. So again, we have heard about stress. We have about this person is very stressed lah. So is this person very stressed one. I mean, do things also everything is like very stressed, very sensitive. So what truly is stress? So stress is a feeling of a state of being overwhelmed by feelings, and it's a response to a recognized threat. So actually, stress can be a normal, or let's not use the word normal, a common reaction towards a threat. So let's say you're walking along the street and you saw a dog. So of course and you're afraid of dogs, or maybe the dog is a fierce one. So maybe at that time you have these stress responses because your body knows that it's a threat, the dog is a threat, and your body is actually having the fight or flight mechanism going on. So that is a stress. However, anxiety is a reaction towards the stress. So let's say going again with the dog, fear of dog example. So let's say if when other times there's no dogs around you, or even you hear a dog barking, and then you get stressed, you get anxious, you get fearful, and that is when it reaches the disorder point, the problematic point. Because even though there is no threat, you can't see the stresses, but you feel the stresses, then that is when anxiety comes in. So always remember that anxiety is a reaction to stress. And stress may lead to anxiety, and anxiety may be a result from a lot of things. And one of it is stress, right? So anxiety is persistent feeling of unease, worry, or fear about the future events or uncertain outcomes. So going back to the fear of dog. So they are always feeling unease when they are walking on the street. They're feeling worried that there may be a dog coming in. The fear that one day they may be bitten by the dog. So even though there's no dog, but they are anxious, they are fearful about it, and this is anxiety, right? So let's move on to look at what are common signs of stress and anxiety. So you can see there are different components. One is physical, so people having stress, they'll have headaches, they'll experience muscle tension, fatigue, palpitation, where their hearts will go beat up, beat up, beat up. So these are actually signs associated with stress and anxiety. Persons who are anxious will have all these signs as well. So it's important to differentiate when it is a stress response or when it's an anxious response and anxiety, right? So in terms of behaviors, the person will feel restless, unable to go out for social activities, will feel agitated, or will have poor self-care. Poor concentration, difficulty making decisions, memory decline, and also negative and unhelpful thoughts are common reactions resulted from stress and anxiety. Similarly, in emotional, irritability, easily getting angry, fearful, and worrisome. So these are common signs of stress and anxiety. And lastly, depression. Again, the terms that we always hear about. So what is depression? So unlike stress and anxiety, depression is a persistent sadness and a loss of interest. So anxiety is a reaction. The person may feel, a heightened tension, heightened energy, but depression, on the other hand, is a more lower or a more milder way of presentation. For example, sadness, sitting alone at a corner, not having energy for activities. So these are depression. And depression actually goes beyond the normal ups and downs of life. So again, when person is stressful, then after that period, maybe the stresses are gone, then the person won't feel stressful anymore. But for depression, it goes beyond that. It will persist for a long time. Yeah. So some other common signs of depressions are little interest or pleasure of doing things, feeling down, depressed, or hopeless, trouble falling asleep because they are having all these negative thoughts running around their brain, their mind. Okay, they're feeling tired, having little energy, poor appetite, or even overeating can be a sign of depression as well. Feeling bad about yourself, that you are a failure, that you are not lovable, you are not loved, or trouble concentrating, and also moving or speaking so slowly that other people notices. So let's say you saw someone who is very energetic and suddenly he or she starts moving slowly, feeling down, having little interest on things that he or she used to do. So this can be a red flag of depression. Yeah. Okay. So in terms of in the context of cancer, how can mental health issues affect cancer patients or cancer survivors functioning? So first thing is emotional distress. So we all know how cancer is such a stressful disease, and the trajectory of cancer itself is stressful, and there's a lot of distress going on associated with it. So mm, having mental health issues on top of cancer diagnosis can actually perpetuate the emotional distress that they are already experiencing, and this can actually mm, affect to the emotional level to a deeper level. So they may be difficult to come out from that distress even more if they have mental issues associated accompanied with their cancer diagnosis. Next, impact quality of life. So again, as we can see the signs of depression or signs of stress and anxiety, right? It will eventually affect the person's life and the quality of it. Let's say the person is not um, having energy or motivation to do the things that brings them joy. Eventually they will feel down. They wouldn't have a better quality of life as well. Okay, reduce treatment adherence. They will feel that they are not worth going for treatment. They feel that even though if they go for treatment, they wouldn't benefit from it. So these are actually common reactions that persons with cancer might have, and also increased physical symptoms. So actually research have shown that persons with depression, with anxiety has a more heightened physical symptoms. They have heightened pain, lower tolerance towards pain if they have mental health issues accompanying them, right? So other than patients, what can mental health issues affect caregivers? Because cancer doesn't only affect the person who is being diagnosed, but also the person caring for the person with cancer, right? So emotional burden, the person eventually feel burdened already from caregiving, and now that they have to deal with their own mental health issues. So eventually they will feel burnout, they'll feel burnout even more. And again, same goes to the emotional distress as experienced by the person with cancer. They will be more difficult to come out from that state of burnout and burdensome, right? Increased responsibility. Now, other than just caring for their persons with cancer, they now have to deal with themselves. They will feel that there's a sense of responsibility. They'll think that okay, maybe now I'm feeling down, so I may not provide the best care for the person who has cancer. You feel a sense of response. I need to do this. I need to be better. I need to get better. Again, so these are the things that can lead to more mental health issues. So it's like a snowball effect, right? So if it's not being solved, you just continue to roll and roll. Same goes to social isolation. They wouldn't prefer going out because they are already so occupied with their thoughts, with their negative, unhealthy thoughts, and also impact on their decision making. If you can recall from just now, one of the signs of anxiety is poor attention. And so they are unable to pay attention to what they are doing at that moment, and they can eventually impact their decision making, right? So move on. After knowing all these health issues, mental health issues, so what can you do about it? So let's say you notice that you have those signs. What can you do about it? And that is when a mental health screening comes in. Right? So oopsie. So what is a mental health screening? So mental health screening is a general assessment on your current psychological state. So it involves various kind of psychological tools to measure your current psychological state. However, it is important to know that a mental screening doesn't warrant a diagnosis. Okay, it doesn't mean that if you have high level of anxiety, you have an anxiety disorder, right? So it doesn't show that it's just a screening tool. Okay, and why do you need it? because mental screening is an entry point to better understand your mental health status. So similar to our title of webinar today, it's a gateway to a better mental health, right? So screening is also like how securities in the airport, they screen for potential threats. Okay, so a mental screening is something to aim to really understand, to get to know what the level of your distress is at now. Or even if you don't have distress, it can be a checkup to see whether you have the risk of getting a mental health issues or not, right? So how it can benefit me? First, it's through early detection. As mentioned just now, it's something to detect whether you are at risk of getting anxiety, depression, or any mental state illness, right? And other than that, it's also something to keep track on your psychological well-being. So actually, mental screening, you can do it over and over again just to make sure that you are at whether you have increased or whether you have decreased, to keep track on it, right? So it's like how we keep track of our health. Where we go for every year we go for annual checkup. So mental screening is something similar as well, right? And lastly is know your level of emotional disturbance. Like just now, if you are a person who is high level stress, maybe this stress are just temporary. It's not persistent. It doesn't prolong, right? So it's something to know the level of this disturbance, the distress that you're feeling because of as a result from this stress, right? So who can participate in a mental screening? So anyone who wishes to know their mental health status can complete a mental health screening. So it doesn't mean that you have to be you have a particular disorder or anything, right? So this leads to our next section, which is the general misconceptions or the myths around mental health screening. So it's common that people would think that mental screening is only for persons who are very stressed, right? So actually, mental issues can result from various factors, not only from stress. Although stress is one of the pioneer or the main reason, but mental health issue can be a result from um, genetic influence. So let's say you have family history of depression, so your risk of getting depression is higher than others, right? So it's not only for those who are very stressed. Anyone can actually do it, as you can recall from the slide just now, right? Next, it's also misunderstood that mental screening can only be done for adults or those who can read. Okay, so actually mental screening comes in various forms and way to administer and for individuals across ages. So a child can do a mental screening as well. An elderly uncle, auntie who can't read or who can't read English particularly, they can do mental screening as well because we have various languages and we have various forms of administering as well. So other than just the typical pen and paper, we can always do observations, like how therapists do observations on children with autism. We observe the level of it. So these are screening tools as well. Okay. So another misconception people think that is I only need to do it once in a lifetime, right? So mental health can actually fluctuate over time in response to situation. So maybe right now you just get you just got married, so that's something very stressful. Okay, in another way, it can be stressful because of you know plan for a wedding, you have to prepare for a home for a family, so it can be a stressful response. So during the time, maybe your stress level will be heightened, or maybe after that you got very stable in your family, then you are okay. Then during the time, your mental status can be lowered. So it fluctuates once in a while. It fluctuates over time, and depending on the available stresses that. So it's not a mental screening doesn't only need to do once in a lifetime. You can do multiple times depending on how you would like to know your mental status. Okay, right. Okay, sorry, just let me. Okay, so I think I've skipped one of the slides just now. Right. So the main conception is that mental screening doesn't only administer for persons with mental health issues, right? So even a psychological healthy individual can complete a mental screening. Again, is to screen for status of it, right? So, okay, it's important to know that a mental screening does not warrant a formal diagnosis. A formal diagnosis needs a lengthy process of various assessments, various interviews, getting know you as a person. Only we can come up with a diagnosis if needed. So by just doing a very short 5-minute screening doesn't warrant a formal diagnosis. Okay, and it only gives you the idea of the level of psychological well-being or distress, right? Okay, so again, it's important to know that it's some of the fact that people commonly neglect is that mental health issue is just as important as your physical health, right? So it's very so speaking from the point of view from a cancer patient, right, it is understandable that this person affected by cancer would place an emphasis on their physical health and getting cured because they would perceive that all the cause of all the issues are coming from the disease itself. However, like how our mind is connected to the function in our body, our mental health will in fact affect our body as well. An anxious or stressed or depressed mind will not help with the healing and recovery process, right? But it will definitely slow down the process of getting medical help or coping with the distress associated with treatment process, right? So again, if you have a very good physical health, but your mental health is not as good as you would wish to be, eventually it will start to affect your physical health as well. So these two comes in pair. So again, people would put a lot of emphasis on physical health, and I truly understand that why. But at the same time, we have to give permission to ourselves to understand our mental health better. Just like how we have already accepted that cancer is no longer only means death. So we can again begin to accept that the importance of mental health in our life as well, right? So what are the ways if you are feeling, okay, hyped up, you want to do a mental health screening? So what are the ways you can actually access mental health screening? So we are proud to present that NCSM right now has launching a mental health screening program, and its the purpose is to enhance awareness on mental health status and also allow accessibility to mental health services for people affected by cancer. Right. So if you are a public person who does not associate anything with cancer, no worries. We have some bonus for you later on as well. Okay, so just stay tuned. Okay, so the targeted participants for this program is for cancer patients, cancer survivors, and cancer caregivers. So whether you are under active treatments, you have completed your treatment and you're now in survivorship, celebrating survivorship, or you are a caregiver, you are free to welcome to join to participate in our mental health screening program, right? Okay, so following the mental health screening, we have a bonus for all the participants as well because we'll be giving free 30 minutes consultation with our clinical psychologist. So we have Kah Yee here, we have me, and we have Eunice here who would give you free a consultation. So the consultation would include briefing you about the result of your mental health screening, and also have a consultation to understand better how the stresses are affecting your life, or how your mental status is at this moment, right? So we believe that having this consultation could better give you an understanding rather than just answering a few questions. Yeah. So how do you participate? First is to register. So later on, SSM will post this poster up in our social media, and also later on I will post this QR code, and you guys can scan as well. Okay. So first is to register. So then complete a survey. I hope that you guys can see clearly. So complete the survey. So you involve an informed consent and also get some demographic data from you guys to better understand you, right? Then later on is the mental health screening. So we have two sets of questionnaire here. One is the generalized anxiety disorder 7 item, which is to measure anxiety. And the second one is the patient health questionnaire, which is to measure depression. So these two are one of the main screening tools that we clinicians use in order to get the understanding of your anxiety level and depressive level, or depressive symptoms level. Okay, next, select 3 preferred time slots. So all these things you'll go through if you scan the QR code, yeah? So select 3 preferred time slots. So we gave flexibility to choose from Monday to Friday, morning session or afternoon session. So the reason why we would like you to choose 3 is because the consultation is based on first come first serve basis, right? So if that slot is really full, then we may need to go to the second slot. So that's why we need 3 slots from you, right? And lastly, it's done. So just wait for our call, wait for us to schedule an appointment with you, and then we can do the consultation with you, right? Okay, so maybe right now you're just okay, you are ready with your phone. Okay, so if whoever are not ready your phone yet, no worries. Take out your phone now because the QR code is here. Okay, so this QR code is only for persons affected by cancer, the three targeted participants, cancer patients, survivors, and caregivers, right? So for you guys, you can scan the QR code in. If you are not accessible to your phone right now, just follow this website. I believe that our technical team would be posting up the link now for you guys to better access it rather than just going through the QR code, because I understand that it can be quite troublesome to go through it. Okay. Right, okay, so I believe that the link is here. So thank you for the technical team. Okay, so for the public, so here are three options that you can choose from. Right? So why three options? Okay, so because all these three different organizations, they provide different tests. Okay, so first, Us Psychologists Malaysia, they provide personality tests, depression, anxiety, and stress scale, and also another one is pediatric symptom checklist. So pediatric symptom checklist is available for parents to do a checklist on their observation on their child or their children to see how what are the issues they're experiencing, or maybe they are not issues, they're just to do a checkup. Okay, and the next one for Allo Mind Malaysia, they are offering a depression, anxiety, and stress scale. At the same time, they have, I believe, they have a free consultation as well, accompanied with this the mental health screening, right? So if you're looking for consultation, then you can go to Allo Mind Malaysia. And lastly is Mental Health America. So Mental Health America, they provide a larger range of tests available. So they have a depression and anxiety test. They have postpartum depression test as well, PTSD test. So they have a variety of it. So you can feel free to choose from it. Okay. So these are for the public, and for the cancer, for a person affected by cancer, the link is already there, right? Okay, so now, so after understanding your mental health, okay, going through the gateway, okay, passing through the security, the custom already. So what next? So this is our upcoming webinar. We'll be talking about a guide to therapy. So after that, you can join this webinar to understand about what therapy is and how is the process, the procedure of going into attending therapy. Okay, so maybe some of you are still therapy can be still something new. So having attending this webinar can be very helpful to really understand how you can help yourself, and therefore from struggle to strength. Okay, understand yourself better. Okay, right. Okay, so I believe that is all from me, the presentation, the webinar. So maybe time for some questions. Okay, maybe before that, maybe I can just share how I feel about this webinar. I believe that this webinar is very useful because we are talking about things that may be a taboo in Malaysia, right? The reason why we are advocating so much on mental health webinars is to make mental health, the conversations around mental health, normalized. No, made like a normal conversation that you can go. So imagine go out for tea with your friends. It's something that you can commonly talk about, and then you don't have to feel fearful to share about your issues, to share about your current situation. So it's something we are trying to do is to normalize the conversations around mental health. Okay, right. So thank you. I'm seeing there are some questions coming out now. Okay, so from Christina. Okay, thank you so much for your question. Can I do a mental health screening every week? Okay, or is there a duration of wait until I do the next screening? Right. Okay. Thank you, Christina, for a very important question. So you can do a mental screening every week. Yes, you can. Obviously, you can do it every day. But what's the rationale of you doing that every day? You know, because for this mental screening, we measure the mental status in the past 2 weeks. So if you do that every day or every week, you just get the similar results. So you can do it if you have the time or you feel like you want to do it, but you don't have to do it if mm, you don't feel like to. It's not necessary to do it every week, lah, right? And it also depends on what kind of assessment tools that you are using. Some assessment tool requires you to wait for a few months in order to do that again, just to prevent biasness. Okay, so it highly depends on the assessment tool that you're using. So the two assessment tool that we are offering is to measure the mental status in the past 2 weeks. So maybe you can wait for the next 2 weeks, then you can do it again to do a checkup. Right? Okay, so I hope that they answer your question. Okay, right, another question from Cairo. Okay, how can a mental health screening show my mental health status? Right, okay. Okay, this is a very good question, because how you may just do it and then how do you know it? Right? So if, let's say, for those who don't have the consultation with us, so how can you know it is by looking at the score. So every different mental health screening tools, they'll have different way of scoring your scores, and by using the score, they'll give you different categories or different levels of distress. So let's say for our G87, there are 4 levels. They have mild, a minimal. Minimal means that there are no or manageable symptoms of anxiety. Then mild level anxiety, moderate, and lastly is severe. So these are the ways that you can know better of how your mental status is by looking at the categories of it. And how do you get the categories? Is looking at the score. So it may need you to do some mathematical skills, so hopefully that by just simple adding, it's enough is okay for you to do it in order to get the score. Right? Okay, thank you, Cairo. Okay, right. So another one is from Zain. Right, Zain asked that I understand that stress, anxiety, and depression can be a common reaction in our life, right? Yeah, true. It can be very common because things stresses are is always here. Right, so how can I know whether it's something that we need to seek therapy and deal with? Right. Okay, so again, these are common reactions, right? Depression, maybe I can have depressive symptoms as well, but remembering the continuum of mental health, right? So it depends on at which point you are at. So are you at a healthy point? Even though you have stress, you have anxiety, or you have depression, maybe the person can be at a healthy point, or at the problem point is nearing towards the healthy point. So that is when, if you feel like the symptoms are manageable, are able to cope with it, then it's something that you may not need to seek therapy if you have the proper coping strategies. However, if all these symptoms has actually reached the disorder point where it's already affecting your daily functioning, okay, you can't work properly or you can't focus properly because of all these symptoms, then that is when I would suggest you to seek therapy and to deal with, um, to look for some of the useful coping mechanism that can help to cope with all these symptoms. And for if you go for clinical psychologist sessions, they may look further. They look into like what are the cause of it, the core issue of it. So we are actually going into our next webinar, really, which is a guide to therapy. So these are how you can actually see like so where you would like to seek for therapy, whether or not you want to seek for therapy. Okay. Okay, right. So from another question from Po Qian. Okay, how do we encourage our family or friend to seek professional help, knowing that he or she is obviously going through some mental disorders? Right. Okay, so I believe Po Qian, you may have encountered some similar trouble to encourage your friend or family to seek professional help, right? Right. So from a professional point of view, of course, we will really much try our best to encourage them. But from a person like you as a friend or family, the way you can encourage them is to provide them more information first. Try not to push them so hard because they might have a certain there's a reason why they don't want to seek professional help. Maybe because of fear. Maybe they're afraid that what they will encounter during those professional help sessions. Right? Because going through therapy it can be a mentally draining process because you have to look in a lot of issues. You have to look in a lot of big pictures. So it can be fearful for some people to go for therapy. So no worries, Portion. Give them time, and at the same time provide them some information, like through this webinar. Let them know that how is it important for them to seek help to have a better mental health, and how if they don't address their mental issue, how can these issues actually impact their life so that they can get a better awareness first. Okay, then next, maybe we can suggest them to do a mental screening like this, right? So they can actually see. So maybe right now, right, you say that he or she obviously going through some mental disorder. Maybe he or she, the person doesn't feel that way. Maybe they think that it's something normal, right? Or maybe they are already so used to those symptoms. So let them know, help them to see with a more objective view through the scores, through the level, through the categories to show that okay, so here is it. You're at a severe level of anxiety and depression, and it's suggestible that you seek help. So by using a mental screening can be a helpful way. It's a guide to to increase the awareness as well. Okay, so hopefully, Fortune, I have answered your question. So no worries, be patient, give them time, understand from their point of view as well why they are so fearful, why they are not seeking help. Right? Okay, next from Carrie Lim. Is mental screening accurate and it can be denial answers when giving the questions to answers? Right. Yes, yes, yes. We understand that mental screening because it's just pen and paper, right? The person can just put in all 0 0 0 0. So it all depends on how um, how truthful the person want to present with. And even if they are not being truthful, you like to understand the reason why. Are they trying to hide their feelings? Are they trying to show people that they are okay? So again, these are something that are useful things to venture into as well. So it may not be 100% accurate. So I'm just going to be very, very honest. It may not be 100% accurate because all these are pen and paper. And even through observational mental screening, it may not be 100% because we are seeing that person in that specific point of time. So, but how can we prevent this is to let them know, okay, this is important to you to answer this as truthful as it can be because it's helpful for you. And for some assessment tools, they are what we call as reverse questioning. So let's say they will purposely reverse the structure of the question to make it sound like it's an opposite. So let's say a question A, they'll say, um, I normally feel sad. So maybe the question will ask that I am content with life. So it's a reverse question. So by knowing that, we can actually keep track whether this person just simply circle or 1110002, or whether it actually validates, like verify the item scores in it. Okay, so again, Carrie, it varies from assessment to assessment. Okay, right. So maybe you can go to the next one. Okay, Shakir Aziz. Okay, after answer the form, such as the one for pediatric, what would be the next step? Okay, so I've gone through the Ask Psychologist Malaysia, the form, right? So what they do is they just give you um, the description of it, of the scores, and then they would actually suggest you to seek help, to schedule an appointment with them. And of course, you can also make use of this score to as as a guide when you bring your if you bring your child to see a doctor. So let's say that for a next appointment, right, with a pediatrics, right, so you can just show the pediatrician that okay, so my son or my daughter is showing this level of score, so what can be done? So the pediatric will eventually either refer your child to a psychologist, or the pediatrics themselves will do an assessment on their own first. So it heavily depends on what are the next step you take. So you can either just leave it be, or schedule an appointment with someone, a professional, or you can bring this to your the doctor's appointment, or in any KKM or in any clinic that they will actually do the necessary lah. Okay. Okay, so I think that's all the questions from me. Right. So okay, right. So maybe you can give like maybe another 1 or 2 minutes to hopefully to digest the things that I've shared, and also to really filter the things because I believe I've shared a lot of things, right? So take some time to digest about it, and at the same time maybe I can share like how Porchin have shared, because I feel like a lot of people, based on my experience, persons with cancer can be quite um, mm, fearful to look for professional help, or maybe they feel that they are okay, even maybe obviously they are not okay. So again, always goes back to as a caregiver, right? So what I can do is understand from their point of view, be empathetic, listen to them. So maybe you can ask. I would suggest you to ask them about it. So what I would do, right, with my own family is that I would do that. Okay, I noticed that you are getting sad lately. That I noticed that you are not eating as much as before. So is everything okay? So this is a conversation starter. So you can actually make use of this conversation to go deeper about it. And after you ask that question, of course, follow up more. Not just, okay, when they say everything is fine, then you just say, oh, okay, fine, then just leave. So ask more. So try to understand them, because maybe these persons are, maybe this person is going through something, they're going through in their mind. So be a supportive person. And sometimes being a physical accompaniment for them is sufficient enough already. Right? Okay, so maybe for the last question from Esan, will there be a next session on this topic? Next session. So on this topic in particular, meaning that on mental health screening, is it? So next session, maybe we can, yeah, I believe that if you are keen for it, we can always go further into what the scores of mental health screening can represent, or even if you have a high level of score, because for the patient health questionnaire, right, one of the items is talking about suicidality, which is something that I would say is important to address. So thank you, Esan, for maybe sharing that. We can look together with Kah Yee, then we'll think about what can do next. Okay, so so for this mental in particular, other than English one, we also have two other languages, which is in Mandarin and in BM. So tomorrow at the same time is in Mandarin. So any one of you have people who would like to understand better on mental screening and they only can converse in Mandarin, feel free to invite them to our session tomorrow. And for those who are Malay speaking, we have another one on Thursday, same time as well, 8:15, same time, same place. Okay, I believe that if the technical team couldn't post up any links here, but you can always go through our social media to look at the time and where to register as well. Right? Okay, so I think that's all for the question today. So if no worries, if you have further questions, feel free to approach us. Feel free to call us at our hotline at 1-800-88-1000. Okay, so it's somehow similar to the Pizza Hut jingle, right? 1-800-88-1000. Okay, so if you have further questions, they need support, feel free to contact us at our hotline, and we will reach out to you as soon as possible and provide as much support as we can. Right? So I believe that's all for today. Have a great rest, everyone, and have a good night's sleep as well. Right? Okay, so thank you, everyone. Bye.